Alright, kia ora and welcome to this Stuff live stream. I'm Thomas Manch, political reporter at stuff.co.nz, and today we're joined by National Party leader Judtih Collins. Tēnā koe, Judith.
Well, ata marie, Thomas.
So, to begin with, the political issue of the week is Covid-19, obviously. On Sunday, the Prime Minister put Auckland into a level 3 lockdown in response to 3 new community cases picked up. We're now 2 days on, more or less, and there are yet to be any new community cases identified. Do you believe she made the right call on Sunday?
I'm not sure that she had any other choice at that moment, given what she had in terms of information. But it now is starting to look as if all of the close contacts hopefully are testing negative, and that there doesn't feel like there's, from the information, that there's any spreading of COVID-19. So hopefully, and I think we're all keeping our fingers and toes crossed, we'll be out of lockdown pretty quickly, hopefully in the next few days.
So you don't disagree with that decision on Sunday?
I don't think you can really when you have the information that she had at that moment. But the trouble is with this is that the information changes as things develop, and right at that stage, I think she didn't have much choice.
But we have had previous cases have shown up. They've been in the community. The Northland case is the most recent example where a decision not to shift alert levels was made. You know, feasibly more information could have come in. The contact tracing effort could have rolled out. Do you not think that we're at a point now where different decisions could be made in those moments?
Well, there might well be, but she's had the information that she had from the health professional. She's made that call. I'm not going to try and second guess every time Prime Minister's going to have to make a decision about these, because she has the information that she has. And I think it's important to be cautious, but it's also important to, I think, if we can end up today with no more COVID cases, and that we'll hopefully have a good decision when it comes to lifting at least some levels of this lockdown.
So it's your view that the lockdown needs to be lifted today?
Well, if we have no more cases, and there's no reason why not, and all of the close contacts have been tested, I think we might be having that sort of result. So I'm just hopeful of it. I think that there are plenty of people in Auckland in particular, but all around the country, who are saying, look, this is their busiest time in work and business, and that this lockdown is costing the country over $30 million a day. According to the economists, it's an enormous amount of money, and we need to make sure that if we don't have any further lockdowns, that we don't need to, if we don't need to.
But what's your tolerance here? I mean, if for instance, Ashley Bloomfield comes to the cabinet table this afternoon and you were there, and he says, look, there are 4 new new cases within the close contacts, but we have found no more. Would you lift the lockdown?
Well, I think I'd be pretty wary of lifting it in those circumstances, just because you don't know where these people have contacted further. New Zealanders, I believe, have quite a low tolerance to COVID-19, but also we tend to take the scanning a little bit for granted, and we don't seem to have the Bluetooth rolled out of the Bluetooth card or anything like that yet. So we have a mixed response in the community, and what we can't afford to have is that New Zealand going in and out of lockdown. We've now been in lockdown 3 times, and this is really, really hurting, particularly small businesses, but is also really disruptive to children and to people's mental health. It's not something we want to see happening.
So you don't have confidence, even if there were a few more cases, you don't have confidence that the government and the country could get its way out of that without being locked down?
I think we'd need to take advice on that. And I'm not the medical expert, but I am very aware that it would be a pretty brave government that went against the medical advice.
Do you think, what's your view on how long, the government's not likely to step down from level 3 to level 1 in Auckland. How long should alert level 2 be in place, do you think?
Well, again, that depends on what they find in the community. What we saw with the Northland case, of course, is that we didn't end up in any lockdowns. there seemed to be no transmission whatsoever outside of the person who had the COVID, and apparently the South African variant, which is supposed to be virulent, and it didn't spread. And the current one is the UK version. It was also apparently virulent, and it doesn't seem so far, the advice hasn't been that we've had any other cases. So I think New Zealanders will be looking to see, can we come out of level 3 lockdown in Auckland, can we move from level 2 to level 1 in the rest of the country, can we move into level 2 in Auckland, and we can move a plan forward to take us back to level 1.
So given that, and given that there's been a few cases, do you think alert level 2 should be in place for 3 days or a week, for instance?
Well,
what kind of level of
well, I
precaution
don't have the
did you
information
think?
that the Prime Minister's got, and I'm not going to go and second guess it.
The-
but it's
the-
really clear that we need to, wherever possible, get ourselves back out of lockdown if there's no new cases.
There seems to be a slight divergence in expert view now. We've had Rodney Jones, he's a sort of an informal advisor to the government, in our papers this morning, saying that this latest lockdown, this latest alert level shift, was a real sort of line call in these cases. The argument being that these are sort of edge cases. They're not clear cases where there's widespread transmission just when you find that one person. Do you think we've sort of reached a point now where the alert level system needs to be reassessed, or the need for lockdowns is in dispute?
I think there's probably a time now where we've got some time to actually think about this, and it is going to be important for the government to actually have a really well thought out plan, which doesn't just include moving into lockdown. And that's where things like the saliva testing and the extra layers of actually protection, but also what we're seeing is that where COVID is coming into the country, it's clearly through the border facilities, and where we have, when we've got our border facilities being held being in the middle of Auckland, in the central business district, in the largest city with a third of the population, locking down a third of the population, when even Victoria and Australia is now looking to put in purpose-built places close to the airport, away from the main CBD, for people to come into where they're not sharing the same air and they've got their own purpose-built places. This is something we should be thinking about very carefully and then getting on with it, because the cost of not doing something is extraordinary. So
the government has thought about that, and the view is that it's basically unviable, that there's not the people living in Waiouru, for instance, to man a facility there. There's not the hotel capacity or the adequate hotels in smaller towns to run these facilities. Also, the view is that this is a system that only will need to be stood up for a year longer, possibly. Why build?
Well, I actually think that this is that's being a little bit hopeful. Actually, there are other places, such as even on the outskirts of Auckland or between Auckland and Hamilton, farms, all sorts of places there. It doesn't have to be Waiouru. It can be very close to where there are people who can work in there. But actually, I think what we're seeing in the world is there's going to have to be mass vaccinations of people. We have only just got into the country enough vaccinations for our border-facing staff. The whole world's going to have to deal with this vaccination situation, because if we think that what we'd call the first world countries are all going to, if they're all immunised, that'll be fine. Well, no, there's a whole lot of the rest of the world that also needs to be immunised, and so I'm not sure that this is just a one-year wonder, the COVID-19 virus. It's certainly other pandemics, they tend to come in waves, and I just think we need to be a little bit more thoughtful about how we handle it.
It'd be quite expensive to build a whole system of facilities that will be fairly single purpose for this pandemic, won't it?
It's expensive, but isn't it very expensive for us to go into lockdowns if it's costing $30 million a day for New Zealanders? So we've got a situation where the cost of lockdown is currently being paid for by, in many cases, by private business, often small businesses and private people, but actually it's the government that actually gets to determine whether or not there is a lockdown.
Just quickly on saliva testing, you've said that it looks useful and it should be rolled out to the border staff, correct?
Yes. Yeah.
Yeah. The government's beginning a trial of it. It's sort of got interrupted briefly with the Pullman hotel spread of the virus. In the meantime, you know, some private companies are rolling it out. We're seeing it in New Zealand now through a private company. What do you make of where the government is at with this?
Well, they seem to be very slow at adopting and adapting to new technology, whether it's on tracing apps, whether it's in terms of Bluetooth technology, whether it's in terms of saliva testing. And one of the things with the saliva testing is I've heard the Prime Minister say yesterday that it's not as accurate as the nasal swab. The difference is that the saliva testing can be undertaken every day, and nasal swabs can't, because of the invasive nature of those swabs and the damage it could cause to people's nasal passages. So it's really important that it's not every day, but saliva testing you can. That way it can be very accurate because you're picking up people every single day.
Why do you think we have been slower on this?
I don't know why they are. I don't know why it is that they seem, because other countries seem to be have adopted and adapted to this new technology, and I'm not quite sure why. But I do think it is important that we understand this is, in addition to the nasal swabs, it is another layer of protection, and it would also make it a lot easier for the border staff to be able to be tested every day. And everything I've read about it, it's cheaper to actually deal with, it's easier to deal with in the laboratories. It is something that we should be adopting.
Is it not fair for the Ministry of Health to look to verify the efficacy of the test and how they might apply it, you know?
Well, I just don't know what it is that they've got, what knowledge the Ministry of Health in New Zealand has that the Ministries of Health or equivalents in every other developed country seems to have. I don't know what's so special, that the knowledge that they have.
Is there any other specific measures you think the government needs to work faster on at the moment and to provide?
Well, obviously, the vaccine. I mean, New Zealanders were told on multiple occasions last year about being at the front of the queue. Clearly, we weren't.
It's here now, and
it is. We're at enough for 30,000 people. We have 5 million people. The UK is now immunised, as I heard the other day, 15 million people. We need to make sure that we really don't just get left at the bottom of the world and the 30,000 border staff being the only ones who are vaccinated. We have people who need to travel. We need to be able to bring people into New Zealand. We need to be able to get back to a normal again, and we can't do that without vaccination.
On the vaccination and acquiring more vaccine, New Zealand looks to be possibly one of the very early countries to acquire vaccine from the COVAX facility, a global facility which is every country pours money into
Yes.
to ensure equitable access to vaccine for poorer countries. Is it appropriate that New Zealand might be one of the first to obtain vaccines from the COVAX facility, given we feasibly need all countries to get vaccinated, even those that can't afford it?
Well, I think there's nothing wrong with New Zealand being actually able to get access to it. And one of the reasons is we have no herd immunity. We have locked up our borders, and we have kept ourselves distant from the rest of the world. So even though we've had a couple of thousand COVID cases, we actually don't have any herd immunity. So we are actually very vulnerable once we start to open up those borders if we're not fully vaccinated.
So no qualms about early access to the COVAX facility?
No, I think we need to look after New Zealand's best interests first, and New Zealanders, and that's really important for us.